steps to become a CRNA now, okay? So, first step. I love being a CRNA because I love pain management. I remember when I was in the ICU and of course I had very sick patient, I was always interested in pain management. I've always wanted to provide safe and effective holistic care to my patients. I still remember when I worked night shift and when I used to have my patients, of course they were asleep, and I used to give them a bed bath, and I used to massage. I used to be all into making sure my patients were comfortable. And I feel like even changing their bed sheets, even freshening them up, and when they are transitioning to becoming more aware and awake, and also helping them with the transition from being totally asleep, very sick, to coming out of it and becoming healthier and better. I used to be so interested in making sure my patients were comfortable and not in pain. Those type of things are great ways of pain management, in the sense that you're not requiring patients to have a lot of opioids, because nowadays there's something called an opioid epidemic, and some people are addicted to these medications. And I love learning other strategies for pain management where I can block certain nerve roots and to allow that patient to not be in pain. You can work in an ambulatory care facility. You can work in a hospital. You can work in a trauma institution, maybe a community center. You can work in a pain management clinic. You can just work straight OB, where you're just doing labor epidurals and C-sections. You can work in a facility where you're putting blocks in, and there's so many areas you can work.